Welcome back to the show, everyone. How many of you out there love to play your sports, but maybe limited due to back or neck pain? Well, here to give us all the reasons why you don't have to live with that, I've got Dr. Rowe from Excel Neurosurgery and Spine with me today. Hello.
Good morning.
How are you?
Doing well. How are you doing?
I'm great. I don't have any back pain, so I don't have any neck pain, so
that's a good thing, right?
But I will tell you what, sometimes, you kind of wake up with a little kink, right? And you're not even sure where it came from, possibly in your sleep. But you're here to address issues that go beyond just a daily soreness, right? A lot of our viewers here in Laguna Woods Village, as I mentioned, are very, very active, but sometimes they are limited by the pain. So where are you seeing demographics sort of in the 60s, 70s, 80s? What type of category are they falling into in terms of back or neck pain? And it's probably not even, you don't even have to stop at that age. I mean, I noticed in your logo, you had sort of a younger person with just a small Band-Aid across her back. We'll talk about that. But in terms of our viewers today, what are you seeing that's happening the most?
The way I like to think about what's happening to all of us actually as we age is that all moving parts at some point wear down. Just like in a car. You can have brake pads that wear down, you can have tired treads that wear down. The tire can get flat. So it's very similar to all the moving parts that we have in our body, including our joints, including our discs. They can wear out over time. And that's a normal phenomenon. So it happens to everybody. Nobody
can't escape it.
Is immune from that. Where we come in is when there is pressure typically on a nerve and or the spinal cord that causes pain from typically nerve compression. And so we always treat patients, first of all, non-operatively with medications, injections, physical therapy. If those things fail, then we consider other options, very ultra minimally invasive options that can help patients get back to their normal lives.
Mm-hmm. So you've switched, I assume, from the traditional fusion of the discs, right? When you do have that herniated disc, to what you're mentioning is the ultra minimalization of being able just to chip away or cut away those little herniated discs, right?
Absolutely. In fact, previously the thought was to not only fuse, but do it in an open traditional way. So as a spine surgeon, I can take a look at the spine either by opening up the skin and the soft tissues and literally filleting open the spine. That's traditional spine surgery. And that's why a lot of the outcomes were not so great. But now we've advanced to the point now where we can literally make an incision the size of a pencil eraser, go in with a high definition camera and endoscope, and then with another tiny little incision, we can do all the work that we typically did in an open fashion through this ultra minimally invasive technique.
It's fascinating. And that's all sort of developed within the last 10 years, right?
That's right.
Yes.
So you can kind of think of it this way as well. Like, we evolved from being able to look directly into the spine, then we were able to make smaller and smaller incisions and then use a high-powered microscope to help us look at the spine. But now what we're doing is we're taking that high-powered camera and putting it through a tiny little incision, going down into the spine itself and doing the surgery or the procedure through a very minimally invasive portal.
Dr. Rowe, in the case of like a bone spur, or what are you calling them, a burr or a spur?
Bone spur, yes.
A bone spur that also, you may or may not have a herniated disc associated with it, but it's also impinging on a nerve and creating a lot of discomfort and pain. Can you perform the same procedure to remove the spur?
Absolutely. And that spur typically comes from an area around the foramen, which is essentially a hole that the nerve exits out of your spine. Over time, you can develop these bone spurs that then cause what we say is stenosis, or pinching of the nerves. But we can now literally go straight down to that area, visualize the nerve, and the stenosis that they have, the pinching, and then take tiny little micro instruments and start chipping away at that bone spur, and then take the pressure off the nerve through a very minimally invasive technique.
And that is instant relief.
That is typically instant relief because you're taking the pressure off the nerve, but it also does depend on how long the nerve has been pinched.
Oh, is that right?
Because I like to kind of describe it as a garden hose. If you had a hose that was watering a bed of flowers, and then you ran your truck right directly over that garden hose, that flow would stop. Now, if that pressure on that nerve comes off immediately, then the flow comes back immediately. But in a lot of cases, when that truck has been on that nerve for weeks, months, and maybe even years,
Right.
when you take that pressure off that nerve, it's still kind of crimped, and it does take a little bit longer for that nerve to recover.
So is that sort of an overnight sensation when somebody does develop a spur or even a herniated disc? Is it instant pain, or is that something that sort of gradually grows and then one day someone's like, wow, what just happened? But yet it had been growing for quite some time.
It depends on whether or not it's an acute event versus a subacute event versus a chronic event. So in the case of a disc herniation, that's typically an acute type of pain where you have a hole in that covering of that disc, which is called the annulus fibrosus. You can kind of think of it as the dough outside of the jelly donut. And that it's good to have the jelly in that donut, but if you have a hole in that donut and some jelly oozes out and it causes pinching of the nerve, that can be pretty instantaneous. And so in those type of conditions, like a herniated disc, we can try an injection, we can try medications, we can try physical therapy. In fact, I've had 2 separate disc herniations in my lumbar spine in my life, and it was the most excruciating pain that I've ever experienced. So I can completely empathize with the pain that my patients are experiencing.
Right.
But luckily, I had an epidural steroid injection, and it just really helped me.
Right, but that's
Almost
temporary.
instantaneously. That is temporary, but it can act as a bridge until that disc shrinks back. If all those things fail, then we can go in there with an endoscope, with this less than 1 hour surgery through 2 tiny little incisions, take out that disc herniation. The patient, in most cases, will feel relief right away. When it gets a little bit more chronic, like the bone spurs, as you were talking about, and a patient has had stenosis for quite some time, we can still take the pressure off the nerve, but those nerves typically take a little bit longer for them to experience the recovery. So the recovery in and of itself can be a little bit more subacute because you're taking the pressure off the nerve, but it takes a little while for that nerve to recover.
Yeah, sometimes it takes up to a year, right?
It can,
for
yes.
years for nerves to recover. What would you say in the case of somebody who has had multiple herniations? Sometimes 2, 3, 4 in a row. I know you said that you had 2. Was it on separate areas of the spine and neck, or were they on top of each other?
In my personal case, it was in the same level, the same side, actually.
Really?
Yes. So
is that possible?
It is possible because, as I mentioned to you, when you have that defect in that covering of the nerve or the disc called the annulus, that defect really doesn't go away. But the body can sort of create a little plug so it minimizes the risk of it re-herniating. But that chance of it herniating from that hole, that annular defect, is always there.
Okay. And so a herniated disc can cause multiple different types of pains, right? You can either suffer from a headache, you can have loss of feeling or numbness in your arms, or it can go down your leg. How does somebody know, oh, this isn't just a headache, this is my discs are herniated, so I must go see a neurosurgeon? What would you say to somebody who develops any number of those sort of other types of pains that they wouldn't associate it with having a herniated disc?
Yeah, so the type of symptoms that you're describing is really dependent upon where that compression is occurring. So it's most common in the neck or the cervical spine and or the back, the lumbar spine, because there's a lot of motion that occurs in those areas, in your neck and in your back. So once a patient starts experiencing those symptoms, for instance, headaches in the back of the neck or occipital-based headaches, that can be caused by nerve impingement. And then if you start feeling pain that radiates or goes from the neck to either the shoulders or down to the arms to the hands, and it's also then associated with numbness, tingling, what we call paresthesias, that's probably related to nerve impingement in your cervical spine. Now, when you're talking about sciatica, that's typically a result of the nerves of the lower back or the lumbar spine. That's when those nerves get pinched off. So when they talk about the sciatica, that's typically nerve pain that results from impingement in the lower back or lumbar spine. And both can be pretty debilitating.
Right. All right, Dr. Rowe, I knew this wouldn't be enough time for us today, but let's let our audience know where you're located.
Yes, so we're in beautiful Aliso Viejo at 2 Journey Suite 200. And it's really right down the street from here, probably about 10 minutes away. It's 949-998-6625. And or you can reach us at excelneurosurgeryspine.com.
Fantastic. Well, I have more questions to ask you and more to talk about, so you have to come back.
Will do. Thank you so much.
Thank you. You're watching This Day on Village TV. We'll be back after these messages.